Hi everyone, welcome back to my YouTube channel. Today we are going to talk about Norma Verticalis. We will start our topic with introduction. Norma Verticalis refers to the top view of human skull, providing a detailed look at superior cranial structures. This view is crucial in anatomy, forensic science, and neurology, as it reveals the relationship between the cranial bones, sutures, and overall skull morphologies. Further talking about its introduction, Norma Verticalis showcased the superior surface of the skull, allowing examination of bony symmetry and alignment. This view is significant in cranial surgery, anatomical studies, and forensic reconstruction to assess skull shape and skeletal integrity. Now let's talk about the bones that are visible from the Norma Verticalis. Norma Verticalis includes several cranial bones that contribute to the top structure of skull. They are frontal bone, parietal bone that are paired bone, and occipital bone that is unpaired bone. So frontal bone and occipital bone is unpaired bone while parietal bone is paired bone. First we will talk about the frontal bone that is unpaired bone. That means there will be one frontal bone in every skull. It forms the anterior superior part of the skull and it articulates with the parietal bone at the coronal suture. Next bone we are going to talk about is parietal bone that is paired bone. That means there will be two parietal bone in every skull. They are located on both sides and top of the skull. They are joined together by sagittal suture and they contribute to the vault of cranium. Next one we have in Norma Verticalis is occipital bone that is unpaired bone. That means there will be one occipital bone in every skull. They form the posterior part of skull that is visible at the inferior edge of the Norma Verticalis. It articulates with the parietal bone at the lambdoid suture. Now let's talk about the key anatomical features of Norma Verticalis. The first is coronal suture. That is, it separates the frontal bone from the parietal bone, or it articulates. It is basically the articulation between the frontal bone and parietal bone. The next anatomical feature is sagittal suture that runs along the midline and it connects both parietal bone. The next is lambdoid sutures that marks the junction between the parietal bone and occipital bone. The next is bregma, that is the meeting point of the coronal and sagittal suture. And the next point is lambda, that is the intersection of sagittal and lambdoid suture. Now let's talk about the clinical and forensic importance of Norma Verticalis. They are helpful in assessment of skull shape as they are used to evaluate cranial development and abnormalities. They are helpful in surgical access point making as they are important for neurosurgical procedures like craniotomies. And they are also important in forensic identification as they help in reconstruction of skull profile for personal identification. So this was all about Norma Verticalis. Hopefully you liked the video, and if you do, don't forget to like, share, subscribe and comment.